This is a mature intumescent cataract, one of those regular COVID cases, post COVID cases that we see. Not yet. So initially, after the incisions and staining the capsule with trypan blue, which I expel with 2% HPNC, I go ahead and attempt my Rhexis with my cystitome. You can already see the egress of fluid, so you have to be extremely careful in this case. This can run away. However, as long as the HPMC doesn't, you can continue. But once you find difficulty, as I have, I opt for my Euthrata forceps instead to continue the Rhexis. And obviously the Rhexis is going to be a wee bit small, as you don't want it to run away. Although I tried spiraling it, it's still a bit small. So again, under HPMC, I make a nick on one side, go ahead, scallop it, and then make a nick on the other side with my micro scissors, and with my micro Rhexis forceps I scallop it. So now you have almost a clover shaped Rhexis. And now look, this is a typical soft mature cataract with a mature cataractish plate. Actually, it's not a, and these can be extremely difficult to remove, because you just watch how it is. I'm trying to bring it out, but look what's happening. I'm only punching holes into it. I'm trying to go with very low phaco power, hardly any, and very low vacuum. In spite of that, it is punching a hole. So I'm just trying to get one edge, not managing. Try to lift it up with my dialer, partially successful, and just try to rotate it. It is sitting flush, almost flush on the posterior cap, so you have to be very careful. You can just go right through, and that's it. I got what I was aiming for. So you get that out. Once you have got this up, there is no problem further. It's hardly in few seconds it's out. And look at the posterior capsule. And these capsules can be like this. It's really irritating to clean them. Not, however, it has to be done. So I'm going ahead with my bimanual under capsule polishing mode, not under my aspiration mode, and very painstakingly remove it. You may have to switch between your capsule aspiration polishing mode and your aspiration mode to remove clumps. So basically, trying to clean everything, do as thorough a job as possible. And on the other side as well. Now my clover Rhexis is much better appreciated. And please watch, there is a plaque in the center also. So I will trying to do posterior polishing, but these are usually pretty resistant. And it is resistant. Sweeping tangentially in the fornix to get as much of these cortical fibers, and I'm trying now to clean the posterior capsule, but it's almost practically of no use. So I put in some HPMC. You can see that, just to show you one of the methods that I use. You can leave it as it is and do a YAG later. Not necessary to do this. However, it's a useful method. And surprisingly, I bent a 26 gauge needle. I am going to peel this. So just watch how well it peels off. Just watch that. And it is very difficult to actually puncture the capsule with this. You have to be a little careful. Of course, you can't do anything. if you really want to, but see how it peels off. And I already know this is going to be difficult with this method, although I've peeled off most of it from the center. So that should be adequate if I can peel it off come a little lower. But look at the capsule folding. This shows that this posterior capsule is not very taut. It makes it little difficult to do this method now. Can persist, but there is a risk because at that capsular fold you can puncture. So I am being very cautious. So once I know I can clear that central area, I put off my Omni Glow so I can see better. This reflex is right in the center and you're not able to see what's going underneath. So I need to be able to visualize that area. Of course, patience is required. Now I go in with my micro Rhexis forceps. Hold on. In fact, I think this part is more difficult than the 26 gauge needle, because if you are not too careful, you can actually catch the capsule with your forceps. You have to be very careful just to catch the peeled up cortical sheet with this. Just going the other way, you can see how difficult it is. It is pretty difficult to visualize. To keep on putting HPMC and you can see how nicely it comes off. So I have got, enough of an area, almost like a capsulotomy, with the capsule intact, of course. I then go ahead and implant my single piece hydrophobic IOL. It's the leading haptic has gone in the back, the trailing haptic is out. I didn't lower down the magnification, and then with the dialer I ease it into the back, and you can see the posterior part. The central part is clear. This should be more than enough. Just removing all the HPMC from the anterior chamber. There are bits and tiny bits of cortical matter as well, that also comes off. And I'm going behind the lens as well. It's important to do this step in this particular case. So if at all there's few bits and pieces that also come off. Once done, just pushing back the iris in there, hydrating my wounds, putting my intracameral antibiotic, and concluding my surgery. Thank you for watching.